So as we discussed in the previous class, I'm just brushing up about the maneuvers because the next airway adjuncts will also cover this part. That's why. So head tilt and chin lift. So this maneuvers are done to open up the airway. As we all discussed in the last class, the tongue fall is the most important factor which will cause airway collapse. So once the airway starts to collapse, even if you supplement air through AMBU or a bag mask ventilation, the air will not cross through the oral cavity and reach the lungs. So that causes airway collapse or a airway failure. So to avoid that, we try to do some maneuvers in a patient which would open up the airway and allow the air which we are trying to push inside the lungs through bag mask ventilation, like pressing the ambu bag or a circuit or through a ventilator, etc. It will maintain the airway more patent. So these maneuvers open up the airway, like the tongue will be moved away from the hard palate, which will lead to opening up of the airway in an unconscious patient. And this head tilt, which will cause aligning of your oropharyngeal and laryngopharyngeal axis in one line, is usually contraindicated in cervical spine injury, because head tilt leads to movement at the cervical spine. If a trauma patient, when you're suspecting any C-spine injury or a cervical spine injury, usually head tilt is avoided. So the best thing to do in those patients is jaw thrust. Jaw thrust is to just displacement of the mandible forward, which will help you in the moving the tongue away from the oropharynx, which will open up the airway again. So this will not have any movement at the cervical spine. And if you have any patient, a trauma patient or a query cervical spine injury, in those patients, we avoid head tilt and chin lift and do a jaw thrust to open up the airway.